Hello everybody, my name is Helen Edwards and I'm now going to follow up with some more information about some important factors that we need to consider in wound care, particularly from the person-centred approach. And I want to thank my colleague who's presented just before me, Wendy, for talking about how these caring attributes, etc., are really important and how trust is really important for nurses and how they work with their patients, particularly in this area of wound management and wound care, because as we know, wounds can take a long time to heal, and we often work with these patients over a long length of period of time. So I'm going to focus a little bit more here now on actually the nurse and the individual enduring collaboration that we have as nurses and the opportunities it gives us to work with these patients. So as I said, this is about really now highlighting the collaboration between the nurse and the individual, that is the patient that we're caring for here with their wound issues. So first of all, we need to sort of say that the collaboration needs to be across all areas. So just want to highlight these particular areas is about clinical management, that this is not about us as the nurse totally managing the wound care, but doing this in collaboration with the patient. And that's a really, really important part there. It's also what's really important here is about how we, as we go through this process of collaborating with our patients, is that we develop new knowledge. And some of this will be about actually wound healing itself, but a lot of it will be about how actually our patients and our clients actually develop this knowledge themselves and how we can help them to understand the process that their body is going through in this process of trying to manage their wounds and to heal their wounds. And obviously this then goes to the broader aspect of how does this then get developed into a healthcare policy. And I think this is a really critical part here that we need to understand, and we as health professionals need to contribute to see how we can actually help keep on developing the healthcare policy in related to wound management and wound care. So just now to keep following up on this theme about the clinical management, this really is where we get this from, is from health professionals. And health professionals can share their knowledge, and this is a really important aspect. And I think particularly in the area of wounds, we have a unique opportunity where we often work individually with our patients, but also with other clinicians from other areas, such as podiatrists, etc. So we actually need to share our knowledge here, and we need to share that often in relation to the particular patients that we're caring for at any particular point in time, that we may have information that we have access to when the patients are talking to us about how they're managing their wounds and how they feel about the treatment they're receiving, how then we can help them to build on that. And we can also do this by then helping them if they, for example, are being treated by a podiatrist at the same time, sharing some of that knowledge, not just with our clients and ourselves, but across health disciplines as well, as are appropriate. And this will give us opportunities if there are ways of maybe thinking that there could be some alternative treatments, and also wanting to increase the likelihood of the success of having the wounds that get healed for these patients who often have these wounds, as we know, for quite a long length of time. It's also important as we're doing this about this working with the individual, the patient, is helping them to also understand how we can assess improvement or deterioration, so that they themselves can actually become a monitor for themselves, so they can be looking at their wounds and thinking about it, and yes, I think it's improving, no, maybe this week it's not as good as it was last week, etc. And what that really comes into here is the area of the skills for self-care. As we all know, we can have these patients who come to us and we treat them for their wounds in our clinics or our hospital settings, etc. But often in between those appointments and those times we see them, these patients are often required to do self-care for themselves for their wounds. And that's a really important area where we need to be able to inform the patients and build confidence in them that they can actually do this. It's their wound, and they really have a lot of control and input that they can have into this whole process of this wound healing. So just still continuing now to build on this idea of the collaboration, I've talked about it being between the nurse and the individual who has the wound, but it really is much wider than that. And that is that these patients often live within a family context. They often have to have other people in their family who help them to maybe dress their wounds for them, care for their wounds for them, and help them to meet the goals that they actually have, and often have to help them how to carry out the management that is required. So if there's certain procedures that they need to do, or treatments, or dressings to put on their wounds, etc., it may actually be important that the family is involved in this so they can help these patients to achieve what they need to achieve. And this then comes down to also making sure that the available resources are there, and they may need to be accessed or sourced, but either if the patient can't do that themselves, then this is where often the family can come in and help with that as well. Keeping that in mind though, we need to always be careful here that while some patients with wounds are very open about their wounds and their management, and very happy to share those with their family members, some may not. And we need to be very cognizant of that, and to help those people who have those feelings and wanting, it's a very private issue for them, that we help them through that process as well. So going on a little bit more here now, this is really about this again, the shared information and decision making. And it's often the patients, they will know that it's their wound, but often they don't really know how much importance it has for them to have this ability to actually be involved in the decision making that is going to be best for them. And this really is a really absolutely key role to this for the nurse, is about how to help to understand where the patient is in this journey, and are they ready to actually want more information and to actually be able to start to take a little bit more control of perhaps the treatment and the decisions that are made about their wounds, etc. So this is a really, really important and key area. So just developing on this a little bit more, we know that it's, as I've talked about it, being that the individual needs to understand their wound and experience it and talk to people about it, etc. But it also is really important for us in the broader context of healthcare, is about that we're always trying to make sure that we're keeping up with new knowledge. And particularly in the area of wound management, as we know, we look back over the years, how much it has changed. New products come on the market, and we need to understand how do they work, are they appropriate for this patient or that patient, and how can we actually bring some of those new ideas and new developments about knowledge into our practice as well. In doing this, it's really important that we therefore then keep up with the government and the research funding bodies to know what guidelines are available, particularly for our own practices, but also now more these days we're finding that there's sometimes some very clear guidelines that have been developed about consumer involvement, and that's really important where again this empowers the consumer. So just as an example of some research that we've been doing at QUT, was we had a Champions for Skin Integrity research program, and it was a program that went on over a number of years. But just to highlight that's relevant to this presentation here is about that we actually held focus group interviews with the residents and their family, and we did this very early on in the process, and we wanted to actually first of all identify what they currently were doing and what their beliefs were. Did they believe that this wound would ever heal? Did they believe that they actually had as much control over their wound and the healing process as they needed, etc.? We also wanted to understand more about them, how they preferred to care for their wounds and their skin. It's all very well us as practitioners going in and when appropriately caring for their wounds, etc., but we can't be there all the time. And again, this is about putting the patient in the centre again and putting them in control of the healthcare that they're providing for themselves. So to help them to do that, we need to know what information they would like to have and in what form they would like it. Some people may like it as a discussion, like I could be having here with a client at the same time as I'm talking to you, or we can ask them exactly how they feel about that sort of process. Do they want to have more discussions about it? Do they like to have documents given to them, like a form where things are clearly laid out about what would be good for them to do, and how we can help them to be more involved in the healing process as well. So it's really important that we actually get this participant involvement, which may not just be the patient themselves, but it may be their family members as well. And also it might actually extend to other health professionals if they are being seen by another health professional at the same time who may have some interest in their wound healing as well. So again, just highlighting again here about this is about more about then the broader healthcare policy. And this is where the consumer and the stakeholder involvement is really important. The consumer is obviously the person who has the wound. And as I said a few times now, that's really important that we know that if they want to have that involvement, they can have it, and we can assist them to have it in a way that's appropriate. And then there's other stakeholders as well, which is often other health professionals, and also often the way in which the healthcare is delivered. And sometimes in the area of wound management, it is often delivered through community services. So the community service areas might be an important stakeholder in this area for as we go forward in developing future healthcare policies for patients with wounds. And this doesn't need to be always a high level health service. It can be a very more easy accessible one. It may be one that is delivered increasingly these days in healthcare. A lot of the activity is now delivered online through videos, direct videos to patients, etc. So we can actually look at doing things a bit differently to how we've done them in the past. But again, to make sure that what we're proposing to think about doing is done in collaboration with the person who has a wound and perhaps their family members as well, and any other healthcare professional that is involved as well. And this way we can develop up really clear and useful, helpful healthcare policy. So that's just a bit of a brief overview there. We've tried to give you a little bit about the collaboration between the nurse and the individual and their family members and other health professionals as provided there. So I hope that that's given you a bit of an idea about where we're coming from in this area about wound management, and particularly the collaboration with the person who has the wound, because they're the ones who have this wound. They are the central person in this whole story that we're talking about today. And I think that's one clear message I'd like to get through. That would be my take-home message. So thank you very much for that.